Hello, I'm Dr. Frances Pitzilis. As a cosmetic physician of many years standing, I've seen people come and go into my clinic, and as someone who perhaps may not be interested in cosmetic treatments, or as someone who may wonder about cosmetic treatments, you may wonder what these patients want. Well, they come to us for a variety of reasons. Generally, it's because looking a bit fresher, better for your age, a little bit younger, more dynamic perhaps, clearer skin gives the person confidence and self-esteem. It's part of improving themselves. Some of the quotes that we have are, "I want to look well, fresher and youthful for my age." Some people want to look great for that special day. It might be a wedding, it might be a school reunion, it might be a special holiday. So people come in before they go away and well before the special event so that they can have everything done that they want and so that their skin has settled. But from a serious point of view, we have patients who come in and tell us that they need to look younger so that they can remain in work and obtain work. These days, with ageism occurring more and more and people having to work longer and longer, this is a serious consideration for these people. In addition to that, some people want to look a little bit better so that they can attract the opposite sex, which is a reasonable thing to be aware of. Some people don't like having acne scars, blotchy skin, a lot of pigmentation, and in fact, melasma, which is stubborn brown pigmentation, is very distressing for a lot of people. And then others come in and they say, "I want my skin to be tighter." And they show you by pulling their skin back and up, as if they'd like to have a facelift. Well, what we do is not like a facelift. It's generally walk in, walk out with very pleasant and no downtime treatments. We can possibly achieve 3 out of 10 compared with a facelift, and we can compare the pros and cons. But people often will do this skin pulling up business and say, "I want to look like this." And back on a serious note, some people come in and tell us that they've had a terrible time. Their husband has died, they've lost a lot of money, the husband's left them for a younger woman, and they sit there and they say, "Do something." And usually a sensitive doctor will do a treatment like Botox, something minor to help that person feel a little bit better, and then follow them up when they're just a little bit more stable and feeling a lot better. And then at other times, we'll have someone say, "But I don't want to look like her." And they're referring to people who've overdone it, the lips that are too big, the abnormal look, and we know that the people with those appearances have a problem with their body image. Most people generally look normal, and no one knows that they've had the treatment done. They just look fresher. And people come in and say, "I want my lips the way they used to be, but I don't want a trout pout." And we understand that. And I say, we don't do that here. And yet others come in and say, "My cheeks are sagging and my neck's sagging, and I want to prevent skin cancers on my sun-damaged skin." And we have treatments to make the skin safer. And at other times, people say, "Everyone says I look sad." And this is the downturned corners of the mouth. And we can help with that very simply, often a bit of Botox, sometimes a bit of filler. And they also say that the children at school Or my grandchildren say to me, "Why do I look angry?" But I'm not angry. I want some treatment for these frown lines. And we help them with that too. So you can see that people have a variety of reasons to come to a cosmetic clinic. It could be that they're extremely stressed and very, very sad, or they just want to look fresher, or they need to find work. But whatever we do, it's sensible and it helps that person feel better.